If you're turning 65 in the next few months, this is the window where Medicare decisions start to matter. Here's the good news: Medicare enrollment isn't that complicated, but the timing and rules are important. In this video, I'm going to clearly explain how enrolling in Medicare Parts A and B works in 2026, including when enrollment is automatic, when you need to apply on your own, how the 7-month enrollment window works, and when it's safe to delay your Part B. Also, how to avoid lifetime penalties. My name is Sean Madison. I have been a licensed agent for nearly 20 years. I specialize in helping people enroll in Medicare correctly the first time. And if you're 64 and a half right now, or if you're recently retired, this is exactly when you should understand how the system works. So I'm going to start with the foundation, which is your enrollment window. Let me back up. So like I said, So Medicare enrollment is mostly about timing and work coverage. We focus on the common gotchas in this presentation: COBRA, small employer plans, IRMAA, which maybe not be something you've heard of before, and then HSAs as well. This is the IEP, your initial enrollment period. So the 3 months before your birthday month, when you turn 65, and then the 3 months after is your Medicare initial enrollment period. So the best practice is to get enrolled the first 3 months before you turn 65. Just get it out of the way as fast as you can, and then coverage will start the first of your birth month. So Part A, Medicare Part A covers hospital inpatient services. Most people don't have to pay anything for their Part A. If you've worked for 10 years, 40 quarters, you're not going to pay anything for your Medicare Part A. Part B covers your doctors, outpatient, imaging, labs, preventive care. There's almost always a monthly premium for your Medicare Part B. There can be an increased premium for certain people, which I am going to talk about. Now, this is a very general statement, but original Medicare generally pays about 80% of your Part B services after your deductible, and you will pay about 20%. And the thing there, like it says here, is there is no cap. So if you had a $100,000 bill, theoretically your responsibility would be 20% if all you have is Medicare Part A and B. Many people are enrolled automatically. If you're already collecting Social Security, retirement benefits, or railroad benefits, then you will be automatically enrolled in Medicare Parts A and B. And you will get that before your 65th birthday. If you are yet, which going forward, a lot of people are going to be collecting Social Security after not at 65, but later on. So if you want to get your full Social Security benefits. Now, if you are still working at age 65, you can decline to take your Part B. You don't have to take your Part B immediately if you're still employed. And there are some caveats to that, which I'm going to go over. Also, everything that I am going to talk about in this video, the links are going to be in the description. The links to the Medicare website, medicare.gov, so that you can reference. There's some different. You have the most updated information. This video is being made in 2026, but everything is likely going to change next year, but the links will still be active and accurate. So when enrollment is not automatic, like I said earlier, if you're not yet collecting your Social Security or your railroad benefits, you must enroll yourself. Most common scenario, you're still working, delaying Social Security, and you turn 65. So you would apply through Social Security either online, over the phone, or go into a local office. Online is going to be a lot easier for sure. If you have active employer coverage, the next steps depend on how big your employer is. If it's bigger than 20 employees, you may delay your Part B without penalty. If it is under 20 employees, Medicare is usually going to be your primary. So you would take you would also take Part B in addition to your Part A if it is a smaller employer. Now, if you have retired or you've left your employer but you're on COBRA, that does not count as creditable coverage. it is not active employer coverage, not that it's not creditable coverage. So that you could, if you're still holding on to your COBRA and you delay taking your Medicare, that could result in a penalty. So again, like I said before, COBRA does not generally protect you from the Part B late enrollment penalty. Retiree coverage generally does not protect you either. And if you delay Part B while on COBRA or retiree coverage, you can trigger lifetime penalties. I'm going to go over that here in a second. So you want to treat COBRA as bridge coverage, not a Part B delay strategy. So how to enroll in Medicare Parts A and B. Decide if you're enrolling in Part A only or Part A and B. Go back to the previous slide. If you're still working and your employer has more than 20 employees, that would be a scenario where you would likely just take Part A and not take Part B. You apply through Social Security, SSA.gov by phone or in person, and then you watch for your Medicare card in the mail. It will give you your effective dates. The effective dates are going to be the first of your birth month. And then create your Medicare.gov account so you can manage your coverage. It's not absolutely necessary, but you can if you want to. And then after you get Medicare Parts A and B, you do want to add drug coverage because there can be a late enrollment penalty if you don't get a Part D plan. Part D is your prescription drug coverage. And then you are able to either get a supplement or a Medicare Advantage, whichever you choose. If you do enroll in Part B later, so you have a special enrollment period because you kept your employer coverage, then you can enroll once you do finally retire. There are specific forms which are going to be, the links will be in the description of this video that you can reference to apply for that. If you just simply did not enroll when you should have enrolled for your Part B, you're likely going to face a late enrollment penalty. And then you would submit one of these forms anywhere from January 1st to March 31st, and then your coverage will take effect in July 1st of that same year. This is how the Part B late enrollment penalty works. So it's a 10% premium penalty for every 12-month period that you delayed Part B. I actually have come across a few people that have delayed their Part B by several years and had some pretty significant penalties on their Part B. And again, that's if you don't have credible active employer coverage. And that penalty will last as long as you are alive, essentially, right? Now, here's some of the costs for 2026. Now, these will likely change in 2027, but they are accurate for this year. So most people pay zero premium for Part A. Your hospital deductible per benefit period is $1,736. And now if you don't have enough work history, as I mentioned earlier in the video, then you can have a monthly premium for your Part A. Part B in 2026 is $202.90, and then your Part B deductible is $283. After the deductible, Medicare, like I talked about earlier, generally pays 80%, and you are generally paying 20% unless you have a Medicare Advantage or you have a Medicare supplement. And then IRMAA, this is for people that have a higher income. You actually can pay more for your Part B and Part D premiums than other people do. So Social Security will look at your modified adjusted gross income from 2 years ago. So 2026 IRMAA is generally based on your 2024 tax return. So if your income is higher, and the charts are going to be in the description in this video, if your income is higher, then you are going to pay a Part B or an increased Part B or Part D premium. And actually, here are those numbers here. So if you are single and your income is somewhere between greater than or equal to 109,000 up to 137,000, then you're going to pay you'll pay the $202.90. If it is over 137,000 but less than over 109, less than 137, you're going to pay $284. If it's over 137, less than 171, then you're going to pay $405. And you can see those get pretty significant as your income increases. So if your income dropped because of a life-changing event, Social Security can adjust IRMAA, right? So if you stop working and your income goes away, then you can appeal that decision, appeal that premium increase. HSA, if you contribute to an HSA, be careful with the time of your Medicare enrollment. If your Medicare coverage is retroactive and you contributed during those months, contributions may be considered excess. So you want to stop HSA contributions before you enroll in Medicare. Like it says, coordinate with a tax professional. Now, after you enroll, then what happens? You're going to get your Medicare card, which is going to, again, have your effective dates on it. And then you're going to decide how to fill in the gaps. You can choose a Medicare supplement and a Part D, or you can choose a Medicare Advantage, which most of the time an MAPD stands for Medicare Advantage Prescription Drug. So it's going to have everything in one. You'll have A, B, C, and D. Now, why might you choose one over the other? A Medicare supplement is going to have a premium. You're going to pay monthly for that. Often the Medicare Advantage plans do not have a premium. They generally come with networks. Some of them may be an HMO even, to where you need referrals for specialists. If you have a Medicare supplement, you can see any doctor that takes Medicare. So if you don't want any gatekeeping, you want to be 100% in control of what doctors you see, what hospitals you go to, and you don't mind paying a monthly premium, then the Medicare supplement is going to be the best option for you. Always definitely want to make sure that you get your prescription drug coverage so that you don't end up paying any penalties. The other thing about Medicare supplements is they are generally medically underwritten, but if you get signed up during your initial enrollment period, if you enroll in a Medicare supplement, there is no medical underwriting, meaning they can't decline you for coverage. If that's important to you, if you've had major medical issues in your past, then you certainly want to take advantage of that. Again, you're going to have a monthly premium, but you want to be in control of your doctors that you see, then that Medicare supplement would be the way to go. Medicare Advantage plans never have any medical underwriting, so every year you'll have the opportunity to enroll in a Medicare Advantage plan if you choose to. So here's your checklist. Oops. So if you're already receiving Social Security and railroad retirement, then you're automatically going to get your card. If you're still working, confirm your employer size and whether Part B should be delayed over 20 employees, then you don't have to take your Part B coverage immediately. You might want to go on mark on your calendar the 3 months before, the 3 months after, just to make sure that you are not missing anything. If you're higher income, you can do some investigation, make a appeal if you want to, if your income's going to be changing, so that you're not paying those higher premiums, and then decide what kind of coverage you're going to want, whether that's a Medicare supplement, a Medicare Advantage plan. Of course, if you have some kind of retirement plan, you might want to choose that direction. So someone like myself can help you with that decision. And as far as I go, if it is going to be best for you to stick with your employer coverage, I'll tell you that, or help you whatever the best option is for sure. So going the wrong direction now. So this presentation is for educational purposes only. Now again, things may change. They will change in the future. That's why I'm putting the links in the description, and I didn't actually put the charts in my presentation because over time those things are going to change. You always want to verify your eligibility. I actually have made some other videos that will help you confirm whether you're going to be eligible for Medicare in the future, whether you have enough credits to qualify, and of course for your Social Security as well. So your next steps, schedule a Medicare enrollment strategy conversation. Hopefully that's with me. We can have a conversation via Zoom. We can have a conversation in person, but have as much information for me as you can, and then we're going to get you enrolled so that you can avoid late penalties.